Yes, we have started the recording. Okay. Good morning to all. Today we have MPCE 2022 assessment in counseling, counseling psychology specialization. Already schedule has sent to all the learners. So far, 5 learners have joined out of 9. Already, Madam has taken, Sangeeta Madam has taken MPCE 021 last week. Now MPCE 22 today, and tomorrow MPCE 23. Vimala Madam will take, and MPC 46, 5th and 6th also Vimala Madam will take this session. How MPC 22 assessment in counseling, the assessment, how the assessment will be taken in the counseling sessions, what type of assessment we do as a psychologist or counselor, whether we can do the psychological testing or not, or just we can screen the problem like that. What are the assessment procedures and techniques? All those things we'll learn today. So we have 2 hours time, 11 to 1 o'clock. Madam will take this session, and in between by 12 o'clock, just a 5 minutes break. After that, again we'll continue up to 1 o'clock. So Dr. Sangeeta Madam is working in Getam University as associate professor in the Department of Psychology. So thank you, ma'am. So now we can continue.
Yeah. Thank you so much, Dr. Prasad, for the introduction. Is my voice clear, or are you hearing some kind of an echo?
Yes, it's clear.
Okay, thank you. So, uh, today's session, the 2 hour session, or rather, I would say 1 hour 45 minutes interaction, will be centered around MPCE 022 assessment in counseling. So, the previous class that was scheduled on Thursday spoke a lot about counseling and psychotherapy. And today we are going to learn about assessment, how it is done in counseling, whether psychological assessment or psychological testing, whatever is needed, right? All these things we will be discussing. So like as other courses in this in this subject of psychology, this course is also having 4 blocks. Block 1 talks about introduction, and under introduction, the first unit deals with introduction to assessment. What actually is assessment? When we are saying we are assessing the condition of our client, how can we define assessment, what conditions are we assessing, right? And then how do we differentiate between testing and assessment? Unit 2 talks about assessment complexities. So it is not very easy to conduct the assessment, right? Certain cases the assessment needs to be conducted only by a qualified clinical psychologist, not by anybody and everybody. I know we all are students of psychology, we all have done psychology at one point in time or other, but certain assessments and certain diagnoses need to be given only by a qualified person, right? And unit 3 talks about the ambience or the climate needed for assessment and counseling. Can we conduct our assessments anywhere and everywhere? Then what kind of counseling is needed? Is it individual counseling or group counseling? And what is the setting to conduct individual counseling or group counseling? Then under unit 4, we talk about determination of aspects that are needed to be covered in our assessment. So block 2 talks about various approaches to assessment in counseling. Unit 1 in block 2 talks about interview, case history, and testing. Unit 2 talks about approaches to counseling, the psychodynamic approach and the cognitive approach. And Unit 3 talks about the person centered approach to assessment and counseling. And Unit 4 talks about the narrative approach to assessment and counseling. Then we move on to block 3, where it is touched upon. The topic is assessment in counseling and guidance. The counseling setting and the role of counselor in guidance and counseling is the focal point in Unit 1. And Unit 2 talks about individual and group techniques in counseling and guidance. Unit 3 talks about counseling and guidance for career planning and decision making. Unit 4 talks about multicultural counseling and guidance. What is the role of counselors in preventing illness and promoting positive health? Then block 4 talks about organizing and planning, counseling and guidance. Under this, we are going to talk about introduction to developing the guidance and counseling program. Unit 2 talks about the rationale behind and the purpose behind the guidance and counseling program. Unit 3 talks about organizing and evaluation of the counseling program, and Unit 4 talks about the methods of evaluation. So, this is going to be our journey today, and yeah, we break at 12 briefly for 5 minutes, and we will wrap up before 1 o'clock. Okay, so that is the agenda for today's class. Now we move on to understanding what is assessment. Now, can any one of you just give your layman's perspective, layman's understanding of what is assessment? I don't know how many of you were there in the previous class, but I would definitely love the class to be interactive. So one of you, I see 5 students here. One of you can just tell me what is your understanding, or one of you or all of you can tell me what is your understanding of assessment. How can we define assessment? Amir? Assessment is the classification of something. You are ascertaining something, you are not classifying anything. Okay, anybody else wants to give it a try?
Ma'am, collecting a data.
Collecting data is assessment. Mhm. Collecting information. Okay, any other thoughts? What is assessment? Collecting and categorizing into a class. Okay, so assessment, while assessing, you are using certain standards or certain systematic procedures for observing a particular condition, right? So while you are assessing, you are describing the status of a phenomena at a particular time. Why at a particular time? Say for instance, have you heard of the PHQ? How many of you have heard about the PHQ? Yes? How many of you have heard about the PHQ? See, this is a readily available questionnaire. Okay, PHQ helps us in understanding uh, the health of the other person, right? And it gives us an information about depressive disorders. Okay, PHQ is a diagnostic tool, assessment tool for depressive disorders. There are a number of variations that exist, but PHQ 9 is used in order to ascertain if a person is depressed or not. This is a readily available tool of assessment used for depression. So, this is one small homework for you all. After the class is done, you could probably Google or download. Okay, you could probably Google or download PHQ9, and please don't administer it on anybody. You administer it on yourself and then try to understand how this is an assessment tool I mentioned, right? you understand how it can be interpreted. Are you all keen to do it now? You want to do it now or you will do it later? PHQ 9? You can always do it later. There is the manual also available. Yeah, there is a manual also that is available online. So you do it yourself and then go through the scoring procedure, depending on which you will be able to classify the condition, the mental health condition of the person. And depending on the scores that we have arrived at, there is a classification that each one can fall into. And uh, no depression, mild depression, moderate depression, severe depression, such categories are already there. And then based on that, you can just guide an individual, right? But because this is a very serious assessment tool, I would suggest you do it for your own self and for your own understanding. Please don't administer on anybody, because they wrongly answer the questions and we tell them that they are depressed. It will be a wrong alarm for them. Okay, so please use these assessment tools very judiciously, and until and unless you are properly trained. Yes, until and unless you're properly trained, you cannot use them. Okay, so Praveena has very quickly shared the link here with all of us, so that you could just, for getting a rock solid understanding. You all are now psychology students doing your final year, right? So you need to have an understanding of the assessment tools that are available, and the PHQ 9 is one such readily available tool on the online platform, along with the assessment and scoring and interpretation. Okay, please do it on yourself. So, psychological assessment generally involves a very comprehensive assessment of an individual. It makes use of psychological tests, which is the quantitative method, or it can be a qualitative method where the client or the person is interviewed and a lot of information is gathered. So, the process of collecting information can be formal, informal, qualitative, or quantitative, right? So, psychological assessment is a process which involves the compilation of information from various sources. Why are we saying various sources? We are using certain tools, then we are using these tools could be related to the intelligence, could be related to aptitude, could be related to attitude, right? And then we are also gathering some kind of qualitative information in terms of personal interviews, right? So everything put together, we are trying to assess a person. Why should we need to assess? The person comes to you because you are the counselor. He comes to you with a kind of a problem, and in order to get an understanding of his condition, we gather information in multiple ways, and then we come up with a specific plan for his guidance and counseling, right? So assessment is the very first type, very first step in any counseling situation, right? So the person, the respondent, presents his problem. He comes to us to seek help. And when we do a complete psychological assessment, we also should bear in mind that we take his history. Now, what kind of a history should we take? Biopsychosocial. Why biopsychosocial? This is a complete health model. Okay, the biological aspect, the psychological aspect, and the sociological aspect. Many a times, what happens is a person may have an underlying psychological problem which manifests itself as a biological problem. So, where does the person go to? He goes to a medical doctor, right? He goes to a physician. For instance, too much of stress can lead to skin rashes, right? So the person unknowingly will visit a dermatologist than handling the root cause of his problem. If he manages his stress levels well, his um, skin problem will subside. But what happens, he is unaware of this and he applies topical medication prescribed by the doctor. 1 or 2 days it may work well, but eventually, because the root cause of the problem is something else, any kind of topical application will not solve the problem. So sometimes it so happens that because of a psychological cause, people experience somatic symptoms. So these are called psychosomatic disorders. So the doctors also should be equipped in such a way that they can delineate what kind of a disorder that the client is facing, right? So once the assessment, the biopsychosocial history is taken, the neurological assessment is done, and psychological testing and physical examination is also done. So this assessment will give a tentative direction or a tentative diagnosis of the condition of the client. So, with this kind of a background information, the counselor can inform to the client about the results and what course of therapy he is going to administer on the client, right? So, sometimes assessment may not involve definite procedures. It sometimes involves usage of tests, and it definitely contributes to the decision making process towards a particular problem. The counselor will help redefine the problem for the client. He will break the problem into manageable pieces and he highlights a specific part of the problem. So, in the entire process, once the assessment is done, the counselor will help the client to, in dealing or in trying to identify the possible solutions to the problem, right? So the examiner has to consider, evaluate, and integrate all the data. Examiner, in the sense, the counselor, and then he needs to produce the results that cannot be evaluated only on psychometric grounds, right? So he needs to take into consideration the qualitative aspect also, right? So assessments can be both process oriented and product oriented. Now, what is the process oriented assessment? They do not necessarily give us a final end product, right? So these assessments are primarily used while guiding an ongoing relationship to direct certain activities, okay? And what is a product oriented assessment? They result in an end report. Okay. So process oriented and product oriented. For instance, you have the career counseling. Okay. Where we conduct some kind of an assessment. What assessment? We can conduct an interest test or we can conduct an aptitude test. Either of these, interest test or aptitude test, once we conduct that, or an intelligence test also, once we conduct that, we get an end result. For instance, if you do the Raven's progressive matrices test, you get the IQ level. And depending on the score you got, a report will be generated, right? Similarly, the 16 PF questionnaire, a report is generated, a graph is generated as to your personality profile, and then you will be able to understand a person's predominant traits. Okay, and aptitude, this is more frequent for children who are at crossroads of making a career choice, right? So when these assessments are given to the target audience, you will have to generate a report at the end. So these are called product oriented assessments. You create a report or a document, right? Uh, and one more major thing that the counselors do is the mental status examination, right? When you're doing the mental status examination, you are gathering information and concluding about the emotional and cognitive functioning of the individual. Now, why should we assess people in counseling and guidance? The basic purpose of carrying out an assessment is to gain insight into the client's condition so that we understand him better and we help the client also know what they can do, what they cannot do. You can also help the client understand what his strengths are and weaknesses are, right? Assessment also needs to be done to diagnose the problem of an individual. For instance, now I told you all about PHQ-9. So someone comes to you saying, I have lost interest towards life. Nothing seems to be like before. And I don't know why I'm breaking down very frequently. I feel like sleeping in my bed always. So all these are, and you are in conversation with that person, and the person's, you ask them, since how long have they been feeling like that? And they say, yeah, it's been close to a month now. Then what do? We will immediately give a PHQ questionnaire to them and see, or you can also give them DAS, depression, anxiety, and stress questionnaire. All these are assessment tools. Okay, they are available online. You can access them, and there is also the scoring and interpretation. DAS is extremely helpful in assessing the client's condition. PHQ-9 is helpful. Then similarly, we have another questionnaire called CAGE, which helps us understand the alcohol dependence of a person. Then we have many well-being questionnaires that are available online. All these are assessment tools. Okay, so these tools help us understand where the problem lies and also help us understand the intensity of the problem. You may ask me, how can we ascertain the intensity of a problem by using the quantitative method? So these are standardized tools that we are using, and depending on the classification of the scores, you can understand whether the person is in low category, average category, or high category of the specific condition that you are getting a result about. Okay, so assessment will help us in career planning and education. Like I have discussed with you earlier, interest schedules and aptitude tests, then personality tests. MBTI, Myers-Briggs Personality Test Indicator, right? All these give us an inkling into what kind of a personality one is, right? Um, so again, when it is career planning, you will come to know which kind of a subject you will flourish in, right? And then what is the purpose of assessment? It will help us predict the future performance. For instance, a person who is very good at social sciences, you go put him in engineering, you can be 100% assured that he may not perform that well, or his heart does not lie in engineering and he belongs to more of social science subjects, right? And sometimes you will also use assessment to evaluate the outcome of counseling, right? So you will assess before the counseling is begun, and you will assess after the counseling has terminated. So if there is a change in the response of the client, you will see that your counseling has been effective, right? Assessment operates on certain principles, right? So our assessment principles are something like, it has to be holistic in nature, it has to be ongoing in nature, accurate, and confidential. What are we meaning when we say assessment should be holistic? There are multiple methods in collecting the data from the client, right? So ideally, we should use a combination of these assessment techniques, because it will increase the likelihood of applying the correct kind of an intervention, and then the solution will be arrived at easily. So the principle of this holistic assessment generally follows a specific process to arrive at an understanding of the client, right? So three things need to be borne in mind by the counselor: what he needs to assess, when should he assess, and in which state of assess, and what state of assessing is required, right? So assessment measures and procedures must be based on the demands of the situation. For instance, someone has come to you as a counselor for career counseling. Now, giving them an aptitude test or an interest test will serve the purpose rather than administering some kind of an intelligence questionnaire. Okay, so you should be able to ascertain what kind of an assessment tool you need to give to the child, and once you give the assessment tool, you have to give them the right kind of instructions and ensure that they are not pretending, they are not camouflaging their original responses, right? So assessment should be ongoing. It has to be a comparison between the problems that the client encountered and how he is able to function currently, right? So what happens with the client currently is of major concern to the counselor. For instance, an incident has happened in the past and the client is not able to function properly in the current situation. So what do we have to do? It has to be, it is a very tactful walk, you know. You have to first help the client manage his current condition better, and then later work along with him towards helping him detach himself from that past incident. Okay, so the conceptualization of the individual must be continuous. So, because the counselor can constantly keep refining the strategies that he is using with his client, then assessment should be balanced. It should make use of the information, normative information, as well as individualized data. Why are we saying normative information? Certain level of stress or certain level of anxiety is accepted in any individual. And we should also see that some people by nature are extremely anxiety prone or stress prone, right? So in such cases, you need to tailor your assessment in such a way that you are able to help the client in a positive manner. Assessment should be accurate. So the counselor needs to have the right kind of skills to interpret whatever the test results are coming out of the assessment, right? So he should have the knowledge to minimize the errors and give the best result possible to the client. And another major thing which I mentioned about counseling as well is maintenance of confidentiality. So the assessment reports also should not be shared with anyone and everyone. The first person who is in full control of the information that is handed over to him is the client himself, and upon his agreement, the information could be shared to anybody else. So uh, why we emphasize on this is the entire counseling relationship is based on mutual trust and confidentiality. Rapport is arrived at only after the client gains a certain amount of trust. Okay, then the entire process of assessment sometimes is very systematic and sometimes need not adhere to this systematic method. It becomes very systematic when you are using any quantitative approach, and the order can go here and there if you are using a qualitative approach, right? So first and foremost in the process of assessment, there is formulation of goals. Second, identify the tools that need to be used with the client and the techniques that need to be used. Gather the data, then interpret the assessed data and integrate the different data from various sources that you have drawn. Come up with the assessment information, and depending on the assessment information, you can reformulate the goal for your client, right? So we are talking about assessment and assessment. How do we assess people? What are the various methods that are available with the counselor to assess the clients? So it varies from case to case, right? It depends on the requirement of the case. And uh, sometimes if the client has come with the problem of anxiety or depression, you could go in for more of a case study method. Okay, so here we will discuss three major methods in which assessment can be done. First and foremost is the interview method, second is the observation method, and third is the case study method. We will just spend some time on this because as psychologists, future psychologists, if you have someone come up to you and say, this is a problem I have, you need to know how you have to gradually progress in your entire process of counseling the person. So, interview is one such technique that will help you gather a whole lot of information about your client, right? So, interview is a very frequently and commonly used assessment tool. And with the help of interview, you are able to gather information about the client, and uh, you are able to understand the plight of the client. So, as an assessor, you should be completely and thoroughly trained in the assessment tool that you are using, right? So, there are various aspects that you need to keep in mind when you are talking about when you are taking an interview. So, you can take the verbal interview, which is face to face. What is the client telling you and how much information are they willing to provide? Some people really take a long time to break the barriers, right? And there is another component called the paraverbal. How does the client speak? Is the speech very very fast? Is he hurrying up? Is it at normal pace, tone, volume? Are there inflections at the right places? Right? So, what is their command on language? How well do they choose their words? All these are your interpretations of the verbal exchange that is happening between you and the client. Another aspect that you would look into is also see whether they are giving out any non-verbal cues for speech. Okay, and how organized is their speech. You will also assess if the client is cooperative, is his participation voluntary. So many a times if the client comes to you on his own volition, breaking the barrier becomes very easy. But if he is sent by someone, if there is some force being used, then you see that you will have to spend around 2 hours or 3 hours of your sessions with the client to break the barrier, right? And then another aspect about interview is, you are you using a structured interview or an unstructured interview, right? So it can be totally a planned interview or an unplanned interview. So what is the structured interview all about? So there are standardized questions, the interviewers are trained, and there is a specific question order. So you need not be directly involved in interviewing the client. If it is a structured interview, you can come up with a standard format where you can have your assistants also draw the information from the client. So a structured interview, they say one good thing about it is the information will be more reliable and valid, right? So with this information you are able to give a diagnosis for a client. How the questions will be either in yes or no, or they will be in the Likert scale format, or some kind of a forced choice format, right? There are different sections that can be there which help in the diagnosis of the client. So very frequently structured interviews come with closed questions, right? So when did, for example, do you like this particular aspect? Yes or no? There is only one answer to that. You cannot say sometimes yes, sometimes no, right? But yeah, unstructured interviews, on the contrary, are completely open-ended. They are not yes or no. They are not the Likert scale, or they are not anything which have a definitive form of asking, right? So these are better suited for general information gathering, and they make use of open questions, right? So major functions of the interview method are: you will be able to describe better, right? You will be able to establish a rapport better, and you will also get into the interactive quality, which is a major aspect of social life, right? So when you are interacting in an unstructured interview, you see that you are able to get an understanding of the client even before you have formulated the goals for the therapy, right? And another aspect is you can explore newer variable for the study. Sometimes the yes or no kind of an interview can factor in only a few things. And when you are actually interviewing in an open-ended format, you see that the aspects you have missed out on the structured interview, you are getting in the unstructured interview method. Okay, I am spending a lot of time on interview observation method and the other method, because you will understand that case study method, you will understand that these are the three majorly used techniques in order to break the barrier with the client, right? So the next technique or the method that is used is the observation method. This is the fundamental technique of data collection. So the counselor is watching the client, listening to everything that he is telling, and the counselor is not manipulating anything or controlling anything, right? So the client can also record findings in ways that allow some amount of analytical interpretation and discussion. So you are selecting, recording, coding behavior. So this becomes scientific, right? So you will ask him questions about how is the client acting? Is he composed? Is he calm? Is he nervous? What do they do and what do they not do? Do they maintain any eye contact? How close do they sit, right? Some of the very important information you can gather from observation of behavior of the people who come to you for counseling, right? So such kind of information can be used clinically. So again, when we are talking about observation method, like we have seen, there are two major types of interviewing: structured interview and unstructured interview. Observation also, we have naturalistic observation, structured observation, unstructured observation, and participative observation, right? So what is this naturalistic observation? This is found to be good for observing only specific subjects, right? You can get valid information about natural behavior, that is spontaneous behaviors, whenever they happen in their um, uh, natural settings. For instance, most of our social psychology experiments that we have studied are perfect examples of naturalistic observation. Then we have structured observation. Here, under structured observation, the experimenter has a control over the extraneous factors, right? And unstructured observation, here there is a broad overview of the situation, and where it can be useful, we have no clarity, but yes, we do record these observations. Then we have participant observation. This particular technique gives an insider's view. So the behaviors are less prone to misinterpretation because the researcher is a participant himself. So if we are wanting to study certain complex things, again, sociologists are the ones who majorly use participant observation method. They go live in the community as a member of the community. They spend around 3 to 6 months in the community to understand more about the problem that they are studying. Okay, so in turn, what happens? These people become accepted part of the environment. So, when one single advantageous aspect about participant observation or the observational method for that matter is it eliminates any kind of artificiality, right? Then we will understand what the case study method is all about. Case study is an in-depth investigation of a single person. For instance, one person has committed suicide. He left behind a suicide note. Okay, so, what are the factors that pushed him into committing suicide? You analyze the suicide note written, you will be able to understand multiple factors. What has been the multiple condition of the person who has committed suicide? What was he lacking in? Okay, and of course, this is not an apt example here, but a case study method can be used in order to get to the depth of the matter, right? So case study is used to understand a single person or a specific group or an event or a series of events or just a family, right? So case study research method took its origin in clinical medicine, where people take the case history, and then the case study method involves simply observing what happens to the client or restructuring the case history of a single participant, right? So with the help of this case study, the counselor is able to investigate a specific topic in a greater detail, right? So that is the precision with which you could arrive at in a case study method. So case study also has its own advantages, and it offers a lot of basal factors of the client on which we can directly draw our opinions, right? So far we have been talking about assessment. Then what is psychological testing? Right? So, psychological testing is a specific field which makes use of samples of behavior so as to assess a few psychological constructs. So, psychological tests are uh, written tests or visual tests or verbal evaluations which are administered on people to assess their emotional functioning or cognitive functioning. So this also is a objective standardized measure of a sample of behavior. What is the sample of behavior? You could be studying intelligence, you could be studying personality, you could be studying attitudes, you could be studying their values, right? So, psychological test can be defined as a sample of individual's behavior which is obtained under standard conditions and is scored according to fixed set of rules that provide a numeric score. Now, how many of you have seen Bhatia's battery or vase or whisk? I'm sure most of you have done Bhatia's battery in your first year, right? There you see you are given different patterns, okay, and if you assemble the blocks in the patterns, right, there is the recording of time that happens when you are doing so, right? And depending on whether you have finished it below 1 minute or below 2 minutes or within 3 minutes, and what if you have crossed the 3 minutes, you get a score, right? So you see, this is a psychological test of intelligence which is being quantified at the end of every attempt, right? You are getting a numeric score. So it is a test, a psychological test is an instrument which is designed to measure unobserved constructs. So these are the latent variables. So there could be a series of tasks or problems that the respondent has to solve. I think you will do Raven's progressive standard progressive matrices soon in your practicals class, which is also a measure of IQ, right? Then you will definitely remember me, because we are using it here as an example in psychological testing. Now, what is the difference between psychological test and psychological assessment? Uh, yeah, psychological test is an objective and standardized measure of a sample of behavior, right? Uh, these test questions are related to whether there is a lot of some aspect or just a little, right? So what happens, some things cannot be direct in counseling. Though the counselors are interested in measuring certain human constructs, they do not have the tools for everything, right? So some cannot be measured directly. For instance, personality. 16PF gives us a score. We can quantify that. But at the same time, how close is it to us, right? So we have objective tests and projective tests as far as personality is concerned. Objective tests are something like 16PF, and projective tests are the Rorschach ink blot test and thematic apperception test. Sentence completion test is a semi-projective test because they are coming in with open-ended questions, right? So it is important to remember that this speaking and responding to the questions in a questionnaire, one is showing their behavior. Okay. So one is the behavior we see, and second, what inferences can we make out of this kind of a behavior. Now, psychological assessment is similar to psychological testing, but there is a more comprehensive nature attached to the assessment, right? There is you integrate the information from multiple sources, then you give them some kinds of tests where you decide whether the person is falling into the normal category or into the abnormal category. You also gather information from other areas like collateral information about the personal information, occupational information, the medical history, right? The farm records, from records or from interviews with his people. His people means if he's a married person or he or she is a married person, the spouse could be a great source of information, right? So, a psychological test is one of the sources of data used within the process of assessment. So you see, assessment is a broader term and psychological test is a subset of the broader term, right? So there is a distinction uh, between psychological assessment and psychological testing. Assessment is a broader term, whereas testing is a very narrow term. Assessment is the process of collecting information, making use of various techniques, whereas testing is a standardized process where you are measuring a specific ability or personality or aptitude or interest, right? So while you are doing assessment, you are also interviewing, you are also taking the mental status examination, you are using a law, you're gathering a whole lot of demographic information, you're also factoring the observations of others, right? Whereas in psychological testing, it occurs only as a part of the process of the entire assessment. Okay, assessment is a complex process, whereas testing is a simple process. The information collected is based only to the test, right? So you know very little about the client's behavior. Then information collected about the client's behavior is more accurate and detailed in the assessment. And sometimes in while answering in a test, the person will think this is the right answer, but what will the other person think about me if I give a different answer? So you see, there's a lot of bias that sets in. Okay, so assessment process will evaluate all the information that is gathered about the individual, and the test, psychological testing, the information is pertinent only to that specific test. So what is the major purpose of psychological testing? We will take a short break till here. Any questions you have? Or we will discuss the questions at the end. I will stop the lecture at around 12:45 or 12:50, and then we can have a discussion. Okay? Just take a 5-minute break and be back. I presume four of you are here, right? So we will go ahead with the next topic. So, yeah, what is the characteristic of a good psychological test? It should be reliable, it should be valid, it has to measure what it purports to measure, it should be giving the same kind of a result if the same person comes after 6 months, as far as certain standard components are concerned, right? So all these things are taken into consideration, and we have different types of psychological tests. We have the intelligence test. Of course, examples are the Stanford Binet intelligence scales. Then we have the Wechsler's adult intelligence scale. Then if we have a scale that measures adults, what about for children? So we have Wechsler's WISC, Wechsler's Intelligence Scale for Children, WAIS and WISC. So WAIS and WISC are from the West. Why don't we have something that is our own? That is how we have Bhatia's battery of performance test of intelligence. So, what is the difference between a verbal test and a performance test, or a verbal test or a written test? Okay, the person needs to be a literate in case he has to do a verbal test or a written test, whereas even the illiterate population can be given a performance test. So Bhatia's battery of performance test of intelligence does not require any level of formal education for a person to be able to perform on the test. Then we have Raven's progressive matrices test, which I'm sure you all are going to do in your practicals starting soon, right? Then we have tests of interest and aptitude. Here we have examples could be vocational Strong's vocational interest blank, or Cuder's preference record, or differential aptitude test, or David's battery of differential abilities. Then we have attitude tests. Attitude tests use Thurston scale or Likert scale. And then we have tests of achievement motivation tests are available. Then neuropsychological tests are also available. uh, why do we use neuropsychological tests? So there are these are tests that are designed in order to measure a psychological function after a neurological issue. Okay, they are used to assess any kind of an impairment after any kind of an illness or an injury. So they basically look at the neurocognitive functioning. Then we have the personality test. The number of personality tests we have are really so many. MMPI, Minnesota Multiphasic Personality Inventory, the 16 Personality Factor Inventory, the NEO-PI, the ISENC Personality Inventory, the Big Five model, right? And then we have a projective test in the form of Rorschach test, then sentence completion test, the thematic apperception test, and then we also have the children's apperception test, which can be used on the specific population of children. Okay, then yeah, some are observation tests. So all these are information related to psychological testing. Then there are a lot of complexities that are involved with assessments. So there are issues, and first and foremost is the prerequisite for an assessment. Does this person actually need an assessment? Okay, if he needs an assessment, what kind of a test needs to be used? Then, as I mentioned earlier, reliability and validity. And one more thing, for most important, is consent of the test taker. Without his consent, you can't force him to take any kind of a test. So, what are the various other assessments in other errors in assessment? So, sometimes on a very pleasant day, your mood is fine, everything is fine. So, you will answer with a certain kind of a frame of mind. Another day, you may be really having a very bad patch at work or in your personal life, and so it doesn't really uh, it doesn't really keep you in a good mood, right? So there are certain environmental factors that may play when we are taking the test, right? So another aspect is the competence of the counselor also. Is the counselor capable enough to assess all these aspects in an objective manner, right? And most importantly, what is the state of the client? Then we talk about the cultural differences, ethnic differences, and the linguistic differences. For instance, if you look at the country Finland, you see that they are considered as a very happy country, right? And that they are not so very expressive in terms of their emotions. But when you take our country, uh, this is very clearly portrayed in movies, emotional scenes in Indian movies vis-a-vis emotional scenes in the English movies. We use a lot of glycerine to show that we are crying, we are in grief, but those people do not express themselves so clearly like we do, right? So you see that there is a lot of uh, linguistic differences, cultural differences, and ethnicity differences also, which brings about an error in assessment, right? So sometimes assessment calls for a lot of time and effort. The client can just take the test and go away, but it really takes a lot of time for the counselor to go through the responses and then evaluate. If there is technology, results are easily interpreted, but not every time we have the help of the technology, right? Sometimes tests are misused or overused, and yeah, sometimes it so happens that even if there is the availability of technology, the counselor is not having the skill to use technology, right? And yeah, so all these things are the challenging aspects of assessment. Then we talk about, one second, I want you all to just see the mental status examination format. One second, I'm just trying to pull it out. Yes, so I'm just trying to share my screen. You can, so here you see, this is a format given to the people who are going to clinical settings to do their internship, right? So this is how you actually learn how to do the mental status examination, right? So this is the information that you are collecting: name, age, gender. Here under name, you need not have to put their original name. For your understanding, you can give them the initials, right? Occupation, income, marital status, patient stay with parents, stays with spouse, has any siblings, right? Is there anyone in the family who is suffering from any physical disorders? You are taking a whole lot of information about the client. Yeah, you can get this PDF. It is there in your internship booklet, handbook, right? So here, in what ways the illness causes inconvenience. So illness can precipitate in different forms for different people, and how has it marred your client's performance, right? So these are the ways in which you could just tick this or under any other, you could factor in whatever your client has mentioned. And then taking information from the client itself is not sufficient. You will also interview the family members. What is their viewpoint about this with regard to all of the above points that have been mentioned, and how were they disturbed, or how has the illness caused any kind of an inconvenience to them, right? So all this has to be recorded in detail as told by the patients and the family members. So this is case history taking. Next thing to do is to conduct a mental status examination. So what is a mental status examination? This is an assessment of a patient's level of cognitive ability, appearance, emotional mood, and speech and thought patterns at the time of evaluation. So it is one part of a full neurologic examination and includes the examiner's observations about the patient's attitude, cooperativeness, as well as the patient's answers to specific questions. So you see how all the information is given here. You can learn how to take the mental status examination and then establish a rapport with the client, and on what aspects you have to mention and establish rapport. Speak directly to the client, make eye contact, right? So you will concentrate on the appearance of the client. How is he moving? What kind of a posture is he maintaining? How is he behaving? What is the affect? Affect is the mood, right? See, affect refers to a person's outwardly observable emotional reactions, and mood is the emotional atmosphere. Okay, speech, the volume of the client, the rate of his speech, the length of the answers to the questions, the appropriateness of the answers, and what is the content of his thoughts. So this, whether he is hallucinating, right, or whether he is having any kind of delusions. So this is how you are going to ask the client. If you want to test them for hallucination, then delusions, then dissociation. You ask them their name, they take a very long time to recollect and give the answer. When you ask them who are you, they give an expression of being lost, right? And then, yeah, so these are certain questions you will use to understand about dissociation, right? And then obsessions, and then to see about how their thought process is functioning, and to understand how their cognition goes on, whether they have proper judgment or no, and if they are having insight into any particular problem or no. So the length of time required for this mental status examination is purely dependent on the intensity of the problem that the patient has, right? So that was with the patient, and as I mentioned earlier, it does not just stop at the patient. The family also needs to be interviewed, relationship with the family, so that also you will note down. You will take down the educational history, the work history, and marital history, right? So this is an example. All this is there in your internship handbook, MPCE 025. So all the material is there. One good thing about, I'll stop sharing now. One good thing about your IGNOU material is that everything is available. If you don't have the physical copy, the copies are present online. All you have to do is just search for it, take the time out, go through them, and read through them carefully, right? So that is as far as mental status examination is concerned. That forms a very, very major part of the entire counseling and guidance. So, I mean, you don't have to take this if the candidate comes there for career counseling. So depending on the problem on hand, you will have to take this mental status examination. For intelligence testing also, you don't have to do a MSc. If he comes to you with some problems related to uh, his mood or his behavior or his cognition or his emotions, then you could just use the mental status examination. Okay. You Someone wanted the PDF file. Uh, I don't think we can attach it here. It is available. MPCE-025 is the code, and you can download the PDF which gives you all the information. Okay. Uh, right. Now, what else? We have spoken at length about interview, case history, and testing. What are the various approaches to counseling? Psychodynamic, cognitive approaches, the person centered approach, and the narrative approach. So, uh, yeah, there are different styles that you could use in counseling. First could be the psychotherapy, where you predominantly employ psychoanalytic methods, free association, catharsis, and trying to interpret from the latent content of the information that they have shared. But in the psychoanalytic method, you generally go back to the childhood experiences, right? So, an afterthought of that school of thought was, not every time you can trace back your current illnesses to your childhood illnesses. So, that way, I think there are cognitive approaches, and REBT, CBT, REBT, and person centered approach, which take to different kinds of assessments, right? And a narrative approach also, where everything goes on as a narration from the client's side, and the uh, counselor is making notes of whatever is the problem, and then comes up with a solution. So you see, there are counselors who adhere to only one form of therapy, but there are a few counselors who feel that the you could use different aspects of different therapies depending on the client that is there on hand, right? So, in order to be able to give the most effective kind of counseling, one needs to be able to uh, tune themselves to be a good counselor, right? So, yeah, the counseling setting, the role of counselors in guidance and counseling. So, if you take the counseling setting, the physical setting, the sitting arrangement, and the proximity between the counselor and the client, it plays a very, very important role. You see, in the previous class, we have discussed about transference and counter transference. The counselor needs to take a lot of care in order to ensure that there is not much of any transference that is happening in the process, right? And then there are certain characteristics of an effective counselor that the counselor need to possess in order to bring about a good outcome for the relationship that they got into. First and foremost, self-awareness is one of the characteristics that a counselor needs to have. He needs to be aware of his own strengths, right? And yeah, and his weaknesses. Not everybody can be good at all things. So the counselor could make use of these strengths in order to be of some kind of a use to the client, right? Just a second, I need to charge my laptop. So another aspect is empathy. We all know the meaning of empathy. We should be empathetic towards the client, but at the same time ensure that this empathy also does not come in the way in terms of yeah. Right. He needs to have empathy as a major characteristic, because without being empathetic towards the client, he may not be able to understand the gravity of the situation. Unconditional positive regard is another aspect or another characteristic that the client needs to, the counselor needs to possess, regardless of the kind of a problem that the client comes with. The counselor needs to have respect and a positive regard towards his client. And then genuineness, warmth, attentiveness, right? Objectivity, being open minded, being sensitive, and being non dominating also is extremely essential, right? And a little bit of humor is also found to add to the flavor of the relationship, right? So there are various goals in the counseling relationship. There could be developmental goals, there could be preventive goals, there could be enhancement goals, remedial goals. For instance, someone wants to change the habit. For instance, again, now let's talk about kleptomania. You know what kleptomania is? These people have an urge to steal things. It's not that they are poor, it's not that they do not have the money to buy that particular thing, but they get a kick out of flicking things, right? So, and if they get caught, it is a very embarrassing moment for them, right? So, probably they have arrived at a stage where they want to change their own um, condition, kleptomania. So they may opt for the services of a counselor, right? So that could be a remedial goal. Then exploratory goal, reinforcement goal. There is the physiology goals. There is the psychological goals. Okay. So the role of a counselor in counseling and guidance is to establish a good relationship with the client, identify the problem, explore the various possibilities, and plan for problem solving. Right? So, what kind of a solution you are arriving at, what kind of a method you are using, all these depend on the counselor's efficiency. And it is the counselor who will decide as to when he is going to terminate that particular kind of a that particular relationship with the client, right? So the next part that we will talk about is, yeah, different individual and group techniques in counseling and guidance. So there are various approaches like we discussed earlier. There is the psychodynamic approach, there is the affective approach, which concentrates more on the feelings aspect. Then we have the behavioral counseling. Behavioral counseling largely, the counseling is done on the basis of reinforcement, the positive or the negative reinforcement that is used in order to make a particular behavior recur frequently or not recur frequently. Then we have cognitive counseling, where a cognitive therapy or cognitive behavior therapy or rational emotive therapy are carried out, and the counselor has a very uh, crucial role to play, because he is going to make the suggestions at the crucial points for the client, right? And so long we are talking about the counselor and the client, the counselor and the client. So all this is about individual counseling process. Sometimes there may be conditions where the problem is not just to the individual, there are many people. So at this time we have the group counseling process. So uh, group counseling process, again, a lot depends on what kind of group you are handling, and then what is the size of the group, right? So bigger the size, uh, difficult will be for any solution to be effective, right? So, ideal size is to have around 7 to 8 members, and acceptable range is 5 to 10. So in a small group, there are 3 or 4 members, and what happens there is member interaction becomes less, and counselors often find themselves engaged in individual counselings within the group. So if there are large groups, the intimacy is lost. There is no comfort because larger the group, people do not find that comfortable to be expressive about their problems. So there is a risk that some members may not speak up at all, and some may speak up too much. So not everybody gets equal kind of an attention, right? So there are some elements of group counseling process which we can yeah, take into consideration. First and foremost will be the establishment of the group, and then identification. What is the role of a group and what is the goal of the group? So here it is a tightrope walk for the counselor because not all people are made up of the same psychological temperament. So the counselor needs to be very careful as to what he is talking and what kind of an impact he is making on the other on the group members. Then what is the productivity level? Right, this is a journey. Right from formation of a group, you see that the group needs to achieve some kind of a stability in how they behave and how the members of the group are becoming committed to the group, and they are ready to reveal more and more of themselves and their problems. Right, then productivity will begin. So, until unless the group arrives at this common stage, you cannot say that the entire purpose of having group counseling has been met. So, by the time the group members reach the productivity stage, then they recognize the inappropriateness of their earlier thoughts, their behaviors, right? And then they take the responsibility of acting on their own in some situations, right? So the counselor at this point encourages to share individual experiences. So while people are sharing their individual experiences, you see that the other person in the group also nods vehemently in the sense, yes, yes, they make such kind of emotion, they make such kind of responses. So the others also feel that they are not the only ones who are going through this problem, but there are many others also who are who are facing such a predicament. And then after the group reaches a certain manageable condition, the counselor needs to decide to terminate the entire group, right? So termination stage requires skill and planning by the counselor. If this has been going on for quite some time, you see that people will become dependent on the counselor or the group members for small things, right? So the ultimate aim of counseling is to make the individual independent and make him be able to take decision for himself, right? And sometimes there are favorable conditions and sometimes there are unfavorable conditions. Some people resist termination, they want to be in this kind of a comfort zone, right? So both the counselor as well as the clients, but whenever you make it on payment basis, yes, people would want to terminate it as soon as possible, right? So yeah, there are certain similarities between individual counseling and group counseling, and both in individual counseling and group counseling, you see that the counselor is a very accepting kind of a person. He is very permissive about the clients, and he encourages them to participate freely and lower their defenses in both the conditions. The differences are that group counseling is done, I mean, individual attention is not given in group counseling, right? And one major aspect here is in individual counseling, it is the counselor and the counselee alone. But in group counseling, you see it is the counselor as well as many other counselees. So sometimes the counselees also offer help to the other counselees, right? So you need to have a attentive eye as to what others are recommending also, right? So this is again a very interesting thing to be noting. So career planning and decision making are also improved with the help of a counselor's interference. You are at crossroads, so you don't know what to do, right? Then what do? You want to see a counselor if you have a problem. But if you do not have a problem, I think you can just go to a counselor who can guide you. And like we discussed this in the earlier class, counseling and guidance are one is a pre-problem condition and the other is a post-problem condition. So yeah, depending on your comfort level, you can go in for a hotline number or an audio phonic mobile conversation or a video conversation, or yeah, whichever way you are comfortable, you will be able to carry it out, right? So yeah, career counseling is all about the counselor trying to put in front of the counselee the various options that are available, help the counselee find the best match for the skills he has, and then take an action towards making the right kind of a choice. Okay, so the same works well for other aspects also, guidance also, right? And then we talk about multicultural counseling. So in multicultural counseling and guidance, uh, this you can go through the information that you have, but just to give you an example, uh, you can see how education is carried out in our Indian setting, right? We are just taught to go from one class to higher class, that class to another higher class. But in the West, the moment the child reaches his uh, he finishes his 12th, he is encouraged to be independent. And how does he fend for himself? He gets into the undergrad course and then he goes for part-time work. He earns his money. Of course, the bills and all are paid by the parents, not a problem. But independent living is introduced very early on in the West. When you compare the same thing with with our context, you see that until unless the entire education is completed, some people go out into the hostels and then accomplish their graduation or undergraduation. But generally, more so, don't take me otherwise, but if it is a girl child, parents wouldn't be that interested in sending the child away to a hostel at an early stage in life, right? So these are cultural differences. And then how we talk about problems and issues, the values we hold, right? And in European countries as well, I have noticed that when people go there to do their masters in MBA, they study for 1 year, they intern for 1 year, and they come back to the university to finish their second year. So you see, there are different ways in which careers can be planned, education can be planned, and when you do not have the right kind of information at hand, you will be at crossroads, right? We are just talking about a very simple problem. Educational counseling or career counseling is not a simple problem, though, because it is going to be your bread and butter in the future, and your heart needs to be in the work that you do. You can't be working for the sake of working till you retire, right? So at all these stages, you see, counseling plays a very, very pivotal role. Yeah, so you can have comprehensive guidance and counseling programs for umpteen kinds of problems. Like I mentioned in the previous class, school counseling, educational counseling, family counseling, marital counseling, premarital counseling, then uh, uh, infertility counseling, health counseling, the prospects for counselors has really improved a lot, and they are finding a lot of salience in health arena. Like I spoke to you about health counseling. For instance, someone who's suffering from diabetes, they really face a lot of mental health issues. They are upset with the way their health keeps fluctuating day in and day out. So will the doctor be able to help them in any way as far as their mental health is concerned? No, because the doctor has a serpentine list of patients to be taken care of. So who can pitch in for that emotional comfort? The counselors. So ideally, and infertility experts, infertility counselors, these people can attach themselves with infertility specialists, and then the time that the infertility specialist is not able to cater to these people who are coming for the therapy, the counselor can pitch in and ensure that they maintain a good balance during the entire process of the treatment, right? So same goes even with cardiac patients. Same goes with diabetes. I mentioned heart patients, infertility, cancer, right? So you see, there is a huge and growing demand for psycho-oncologists. Oncology is the study of cancer and its repercussions, and psycho-oncologists look at the psychological aspects of what uh, a terminal disease like cancer brings in. And I feel with the advancement in medicine, very soon cancer will cease to be a terminal illness, because we are able to manage the illness to a great extent, right? So yeah, like I mentioned, this is my wrap up statement. 2 hours is too small a time to put the entire course in a capsule. I have tried to put in as much as I could in the 2 hours that we had. We can just very quickly discuss if you have any questions for say 5 to 7 minutes, and I need to wrap up by 1 o'clock because I have another class at 1. Any questions that you have that need to be clarified? So the mental status examination format is there in your internship booklet, as well as your material for this particular assessment in counseling and guidance as well. So all you need to do is take the time out to read each and every topic, right? And I feel rather than the full-time students, the ones who have joined part-time and are doing distance mode are the ones who are more interested in the subject, right? So please take the time out to go through your notes. There is ample information that IGNOU has put in the material, and then that will definitely keep you all in a good stead, not just to handle your question papers or your end semester exams, but also to move you as a good counselor, right? Any questions? Prashant, no questions this time, no discussion this time.
No, actually, it's okay. I mean, we didn't do any kind of what do you call counseling before. So once we are in the course of doing it, so once I get good knowledge about it, then I might ask you.
Okay. Praveena?
Okay, madam.
Right, sir.
Okay, now we are concluding this session.
Okay.
Thank you very much, Dr. Sangeeta ma'am,
Thank you, sir. Thank you.
today for sparing your valuable time and giving the inputs to our learners. So thank you once again.
Thank you,
Tomorrow,
sir.
again, 3 to 5, Dr. T.D. Vimla madam will take this session, MPCE-023. So 3 to 5 tomorrow. Already we have sent the link to all the learners. Thank you, ma'am. Thank you once
Thank you, sir. Thank you so much.